Okay, welcome back everybody. This is the second video in the little series we're doing on feline otitis. I mentioned in the last video that we've already done a bigger case series on otitis in dogs, so please do go back and look at that. We'll link it down below. Great, so I'd love to introduce you to Hunter. Hunter was an 18-month-old male neutered domestic shorthair who came to see me last year. He had a 10-day history of ear problems, so he had head shaking and really thick tarry black wax. His owners described that he'd become progressively more under the weather, he'd become a little inappetent and just wasn't his normal sparkly self. His vet started him on some Canaural. He then continued to worsen. He was really shaking his head and he was spraying kind of horrible bloody discharge up the walls every time he did so, and he'd continued to be inappetent. His vets had taken some biopsies and then referred him on to us. So when we saw Hunter, his general clinical exam was fine. He was really pink and hydrated in his gums. His cardiovascular exam was fine. His abdomen was really soft and comfortable. He had an ideal body condition score. And the majority of his dermatological exam was very settled. But we found we had very ulcerative skin around the entrance to his ear canals and in the ears, and a lot of purulent material was present. So here are some images of what we found when we first saw Hunter's ears. You can see that they're really full of sort of horrible material. This was very painful and he was really not happy with us looking, so we didn't attempt to clean this away or look down his ears. We managed to do an impression smear with a slide from each ear to look at some cytology, which I'll show you now. And we can see that we had a large volume of neutrophils, particularly in the right ear and rods, and a lower number in the left ear, but still fairly moderate. So this is clearly quite an unhappy ear with some secondary infection. So initially we started some Horizon. Now this is off licence. It's not licensed in cats. It's also not licensed if there's a ruptured eardrum. And of course we had no way of knowing what Hunter's eardrum looked like, but it is considered safe. And it's one I use quite a lot in dogs. If we've got a Pseudomonas otitis, it will treat rods quite effectively. So we started on some Horizon twice daily. And we also started him on some sublingual buprenorphine because he was really painful. We wanted to avoid non-steroidals in case we needed to give him steroids, so we held off Metacam, particularly where he was a little inappetent. But he was a nice cat. His owners felt that giving the oral buprenorphine would be manageable. It can be given every 6 to 8 hours. We started off with 8 to 12, and the dose range is 0.01 to 0.03 mg per kg. We split the difference and went with 0.02, so he was having 0.1 mils every 8 to 12 hours. So we saw him back a week later and he was doing a lot better. His owner said he was much brighter, the head shaking had reduced and there was less discharge. He was being a really good boy and letting his owners apply his treatment. And when we checked cytology, it was now normal. But what we did find was these really interesting lesions in both of his ears. Now this made us very suspicious for proliferative necrotizing otitis externa. The eagle-eyed of you may recognise this from a previous slide where I showed PNOE. This is what we really suspected Hunter had, and at this point we were just waiting for his biopsy results. Helpfully, they came through around the time of his consult and they did confirm the diagnosis. So we diagnosed Hunter with proliferating necrotizing otitis externa. I've popped some information there about what else we found on the histology, but this was fairly clear-cut that this is what he had. So how do we treat PNOE? Tacrolimus ointment is our treatment of choice. People have looked at steroids. They're generally not very effective in this case. People have also trialled cyclosporin and had variable results. The difficulty with PNOE is that it's thought it will resolve spontaneously at some point, but it can take years to do so treatment is still recommended. But it's therefore quite hard to gauge, well, has the treatment improved it, or was it going to resolve anyway? But we felt that because Hunter was a good boy, we didn't want to go down the cyclosporin route. His owners felt that tacrolimus would be feasible. So that's what we recommended. We recommended twice daily tacrolimus, so 0.1% protopic. We then saw Hunter back for a 5-week recheck, and I think this picture speaks volumes. His owners were super pleased. They said he's completely back to his normal self, really bright, really sparkly. There was no head shaking, there was no ear scratching, there was no discharge. They said they could still feel some little lumps kind of at the end of their finger when they were applying the protopic into his ear canal, but there were no visible ones anymore. So we tapered the protopic down to once daily with a view to then recheck after a couple of weeks with his vet and then ease off perhaps to every other day and then eventually to stop. and his owners were delighted. I've since heard that he's made a full recovery and there's been no relapses, which is great news. So thank you everybody for watching. I hope this little mini series on feline otitis has been useful. As always, we'd love you to please subscribe to the Langford Academy channel. It really means a lot to us, and we've got lots of great content coming up. Thank you again for listening. I've been Steph, the dermatologist at Langford. Thank you again.